Expat Guide. Thailand, the essential guide to becoming an expatriate in Thailand. Part 4 of 12. Health and Insurance. Staying healthy is a top priority, especially when you're living abroad. Understanding Thailand's healthcare system and the various health insurance options can help ensure you're prepared for any health-related issues that may arise during your stay. Healthcare system in Thailand. Thailand's healthcare system is a mix of public and private facilities. The country is known for its high-quality healthcare, particularly in larger cities like Bangkok, where some private hospitals are on par with Western standards and have English-speaking staff. However, in rural areas, the quality and availability of healthcare can be less reliable. Public hospitals provide affordable care, but they can be crowded, and you may face long wait times. Private hospitals offer faster service and more comfortable facilities but at a higher cost. Public healthcare. Thailand's public healthcare system is well regarded, offering good quality medical services at a low cost. This is provided through a mix of district health systems for primary care and provincial hospitals for secondary care. The country also has a universal healthcare coverage scheme that provides nearly free healthcare services to Thai citizens. Private healthcare. The private healthcare sector in Thailand is also robust, especially in larger cities like Bangkok, Chiang Mai, and Phuket. Private hospitals often offer a higher standard of service and comfort compared to public hospitals, with many having state-of-the-art facilities and English-speaking staff. These tend to be more expensive, but still generally cost less than equivalent services in Western countries. Medical tourism. Thailand is a major global destination for medical tourism. The country's hospitals offer a wide range of medical procedures, from cosmetic surgery to major heart surgery, at a fraction of the cost compared to the US or Europe. Dental care, eye care, and wellness treatments are also popular services sought by medical tourists. Pharmacies. Pharmacies are widespread throughout Thailand, with many medicines available over the counter that would require a prescription in other countries. However, certain drugs, particularly controlled substances, do require a prescription. Healthcare for expats. Expatriates do not have access to Thailand's universal healthcare coverage scheme and must pay for medical services either out of pocket or through insurance. It's crucial for expats to have comprehensive health insurance that is valid in Thailand. Overall, Thailand's healthcare system is quite effective and offers a wide range of services. However, it's recommended to have a good understanding of the healthcare system and secure adequate health insurance before moving to Thailand. Health insurance options. Local health insurance. There are many Thai insurance companies that offer health insurance policies. These generally offer lower premiums than international insurers, but the coverage may be limited to specific hospitals or treatments. Some expats choose a local policy to cover basic medical care and use savings or supplemental insurance for more serious conditions. International health insurance. International health insurance is often recommended for expats as it provides a wider range of coverage, including the option to seek treatment in other countries if needed. This can be especially beneficial for those with pre-existing conditions or those who frequently travel. However, these policies can be more expensive than local options. Travel insurance. Travel insurance can offer short-term coverage for medical emergencies and other health-related costs while abroad. This can be a good option for tourists or for when you first arrive in Thailand. However, it's not designed for long-term residents and often doesn't cover routine medical care or pre-existing conditions. Social Security Scheme. Expats who are legally employed in Thailand and contribute to the Social Security Scheme have access to certain medical benefits. This includes treatment at government hospitals but may not cover all types of treatments or private hospitals. Private medical insurance. Some expats may have access to private medical insurance through their employer. This often provides comprehensive coverage, but it's important to review the policy carefully to understand what is and isn't covered. Regardless of which type of health insurance you choose, it's crucial to carefully review the policy details, including the coverage limits, exclusions, co-pays, and choice of healthcare providers. It's recommended to secure health insurance before moving to Thailand to ensure you're covered from the moment you arrive. Vaccinations and preventative care. Before moving to Thailand, it's important to ensure your routine vaccinations are up to date. This usually includes measles, mumps, rubella, MMR, diphtheria, tetanus pertussis, varicella, chickenpox, polio, and your yearly flu shot. Recommended vaccinations. In addition to these routine vaccines, the U.S. Centers for Disease Control and Prevention, CDC, and World Health Organization, WHO, also recommend the following for those moving or traveling to Thailand: hepatitis A and hepatitis B. These diseases are transmitted through contaminated food and water in Thailand, as well as through sexual contact and contaminated needles. Typhoid, also transmitted through contaminated food and water, and is recommended if you plan to eat in smaller, local establishments or rural areas. Japanese encephalitis. Consider this vaccine if you'll be living in rural areas or plan to spend a lot of time outdoors. Rabies. While this is not a routine vaccine, it may be recommended if you plan on spending a lot of time outdoors or will be at a high risk for animal bites. Yellow fever. There's no risk of yellow fever in Thailand. However, the government requires proof of vaccination if you are arriving from a country with risk of yellow fever. Preventative care. In addition to vaccinations, it's important to take precautions against diseases transmitted by mosquitoes, such as dengue fever, chikungunya, and Zika virus. This includes using mosquito repellents, wearing protective clothing, and staying in accommodations with air conditioning or screens on windows and doors. Further, be cautious about food and water hygiene to prevent diseases like traveler's diarrhea. Stick to bottled or purified water, avoid ice unless you're sure it's made from purified water, and eat fully cooked food. Having a comprehensive health checkup before you leave your home country is also recommended. Regular checkups are also advisable while you're in Thailand to ensure ongoing good health. Healthcare in Thailand is generally of a good standard, especially in larger cities. However, it's always best to take preventative measures to avoid getting sick. Dealing with medical emergencies. In the case of a medical emergency in Thailand, there are several things to keep in mind. Emergency services. Thailand's nationwide emergency number is 1669. Which connects you to the Medical Emergency Assistance Service. In major cities, ambulance services are generally good, although traffic congestion can sometimes lead to slower response times. Ambulances are staffed by trained medical personnel ready to provide immediate treatment. Hospital services. Many larger hospitals in Thailand, particularly in Bangkok, have accident and emergency departments that are open 24/7. These hospitals are well equipped to handle a range of medical emergencies. Some of the top-rated hospitals in Thailand include Bumrungrad International Hospital and Bangkok Hospital, both in Bangkok. Medical evacuation. In the case of a serious illness or injury, especially in more remote areas, medical evacuation, medevac, to a better-equipped hospital, often in Bangkok or sometimes even to Singapore, may be necessary. This can be very expensive, so it's crucial to ensure your health insurance covers medevac services. Pharmacy services. Pharmacies in Thailand are typically well stocked, and many drugs can be purchased directly over the counter. In many cases, pharmacists can provide immediate assistance for minor health issues. Communication. While many doctors and medical staff in larger hospitals and cities speak English, this may not always be the case in smaller clinics or rural areas. It can be useful to learn some basic Thai medical phrases or have a translation app on your phone. Remember, in any medical emergency, it's crucial to stay calm and communicate clearly about the situation. Make sure you always have your insurance details to hand, know the location of the nearest hospitals, and have a plan in place for medical emergencies.